Hello friends, I am Professor Smita Jha from the Department of Humanities and Social Sciences, IIT Roorkee. I'm here to discuss the course titled Health and Disability in Humanities. Well, these days, in the age of interdisciplinary researches, health and disability in humanities, this particular discipline emerging very, very fast. So let us see the core areas, the keys, term, and the details about health and disability and medical humanities. So, the key aspect discussed in the course definitions of health medical humanities. Why health medical humanity? This is the most prominent question. What are the key terms to drive the course meaningfully? Then, subfields of the course and also foundational text and journal, how to publish in the area of medical humanities and health humanities. Well, I just started with interdisciplinary research field because, as recently pointed out by Hoffman et al. 2013, 8057, interdisciplinarity has been a buzzword for the last 4 or 5 decades, despite the lack of a consensus about its precise meaning. And this is possible because, the advancement of technical tools and also the globalization. In recent years, interdisciplinarity has been viewed as the best way to solve urgent, complex, and global problems. It is considered capable of solving more, at least, different problems than traditional monodisciplinary research. It is often viewed as bringing a fundamental change in social science. So let us start with medical humanities because there is a trajectory for medical humanities, health humanities. So medical humanity is a well-established interdisciplinary research field that investigates the complex human experiences of health, illness, and medical practice. It operates at the intersectional of medicine, the humanities, the social sciences, and the arts to provide a more holistic understanding of healthcare. While there is no singular definitive definition of health humanities, it is valuable to explore few distinct definitions that highlight its scope. By examining these perspectives, we can better understand the contributions of health humanities to medical practice and education. The American Association of Medical Colleges elaborates on the fundamental role of the arts and humanities in medical education by defining health and medical humanities as content or pedagogy derived from arts and humanities and integrated into the teaching and learning of medical students, trainees, and practicing physicians. The approaches and experiences with this education are often interprofessional, interdisciplinary, and co designed to teach and sustain diverse competencies for better health outcomes for patients, communities, and population. Adapted from the National Library of Medicine's definition, health humanity is a field concerned with understanding the human condition of health and illness in order to create knowledgeable and sensitive healthcare providers, patients, and family caregivers. As a field, the health humanities draws on the methodologies of the humanities, fine arts, and social sciences to provide insight, understanding, and meaning to people facing illness, including professional care providers, lay care providers, patients, policymakers, and other concerned with the suffering of humans. The Health Humanities Consortium in 2021 gave a definition of health humanities as the study of the intersection of health and humanistic discipline, such as philosophy, religion, literature, fine arts, as well as social sciences research that gives insight to the human condition, such as history, anthropology, sociology, and cultural studies. The health humanities are methods such as reflection, contextualization, deep textual reading, and slow critical thinking to examine the human condition, the patient's experience, the healer's experience, and to provide renewal for the healthcare professional. In the book Medical Humanities, an introduction by Thomas R. Cole defines the field as a multi and interdisciplinary field that draws from many disciplines to examine issues related to the development and practice of medicine and healthcare. It has an essential practical component because all medical humanities knowledge carries implications for the care of patients, the professional development of students, the continuing education of physicians and residents, and or the health of populations. Medical humanities can be defined as an inter and multidisciplinary field that explores context, experiences, and critical and conceptual issues in medicine and healthcare, while supporting professional identity information. Health and disability humanity as an interdisciplinary field examines the human experience of illness, health, and disability through the lenses of the arts, social sciences, and humanities. Rather than focusing solely on clinical outcomes, this field explores the cultural, social, and political meanings assigned to human bodies and minds. Medical humanities have established their importance in both medical education and practice of healthcare, providing valuable insights into the complexities of human experience, the nature of illness, and the dynamics of the doctor patient relationship. These explorations offer a nuanced understanding of how personal and cultural narratives influence healthcare. In the light of evolving disease pattern and the increasing variety of health challenges faced by diverse populations, the field of health humanities has emerged. This newer discipline seeks to broaden the traditional boundaries of medical humanities by incorporating a wider array of perspectives and disciplines, thus addressing a more comprehensive range of health related issues. Health humanities encompasses transdisciplinary research that investigates the complex relationship between the human condition and health. The applied humanities offer rich insights into subjective human experiences, enabling future health professionals to grasp the fragility of health, the intricacies of the US healthcare system, global health issues, and the profound implications of medical interventions or the absence thereof. By utilizing various mediums such as storytelling, literature, blog, fine arts, visual arts, and historical documents, health humanities can inspire students to conceptualize health, illness, and health disparities within their socio-cultural and historical context. This field encourages students to engage with the multitude of diverse perspectives that may differ from their own. Moreover, health or medical humanities pedagogy fosters essential competencies in communication, active listening, observation, self reflection, and tolerance for ambiguity, skills that are vital for both healthcare professionals and their patients or clients. Some scholars contend that the framework offered by health humanities is not only more inclusive but also superior to that of medical humanities. This argument invites a thoughtful discussion about how these two fields might redefine their relationship and collaborate within the context of interdisciplinary scholarship, ultimately influencing future approaches to health and medicine. Health or medical humanities fosters collaboration among practicing health professional, traditional humanities, scholars, artists, writers, and students in the humanities and social sciences, as well as those in pre-health and health professions. This field actively explores the human condition and its relationship with health, illness, and healing through diverse humanities perspective. By examining the history and culture of medicine as well as concept of embodiment, identity and social connections, it prepares aspiring health professional to engage thoughtfully in the healthcare landscape and to become compassionate advocates for the individuals and communities they serve. Medical humanity intersects with several different fields of study, and these includes but not limited to anthropology, as I discussed earlier, also philosophy, visual art, law, history. So why anthropology? Well, considering the first intersection in the context of medical humanities, anthropology, specifically medical anthropology, serves as a bridge between clinical medicine and the social sciences. It treats health, illness, and the body as biosocial phenomena, meaning they are shaped not just by biology but by culture, history, and political economic forces. Anthropology's unique role within medical humanities include firstly humanitization of medicine. Anthropology helps restore balance in medical practice by shifting focus from the purely mechanical aspects of disease to the human experience of illness. It provides tools for physicians to practice with both objectivity and compassion. Secondly, differentiating disease versus illness, a foundational contribution of anthropology is the distinction between these two terms. Disease refers to the biological abnormality defined by clinical medicine. On the other hand, illness is the patient's subjective socio-cultural experience of being unwell, which is shaped by their society's values and beliefs. Thirdly, critical analysis of biomedicine. Within medical humanities, anthropology views Western biomedicine as a cultural system itself. This allows researchers to critique how medical power, authority, the technology are applied, often revealing how they can perpetuate social control or inequalities. Fourthly, addressing culture bound syndromes. Anthropology identifies conditions that are recognized as diseases only within specific cultural groups. For example, susto in Latin America or coro in China. These examples illustrate how culture can dictate what is considered normal or pathological. Then coming philosophy. Well, what is philosophy's role in medical or health humanities? Philosophy acts as a feeder discipline that provides the analytical tools for other humanities areas. In the health and medical humanities, philosophy serves as a critical foundation for analyzing the nature of medicine, its ethical boundaries, and its ultimate goals. While clinical medicine focuses on the how of treating disease, philosophy addresses the why and what of health itself. Core philosophical contributions of medical humanities include firstly, defining health and disease. Philosophy interrogates whether health is merely the absence of disease or a positive state of well being. It examines how culture and values shape these definitions, such as in the case of medicalization, where non medical conditions like aging are treated as diseases. Secondly, epistemology in medicine. Again, knowledge. This branch of philosophy examines how medical knowledge is produced and validated. It critiques movements such as evidence based medicine, questioning whether randomized controlled trial should always be considered the gold standard of truth. Thirdly, metaphysics and the human person. Philosophers explore the concept of personhood, consciousness, and the mind body connection. This is crucial for navigating modern challenges like artificial intelligence in diagnosis and end of life care. Fourthly, ethics and bioethics, which is very important in medical or health humanities. So, philosophy provides the moral framework like autonomy or justice used to resolve dilemmas in patient care, such as informed consent and resource allocation. Fifth, Narrative and interpretation, it helps clinicians move beyond pattern recognition to understand the unique illness narratives of patients, fostering empathy and practical wisdom, which is called phronesis. Sex, aesthetics, and well being. Philosophical traditions in aesthetics reveal how beauty and art therapy can be powerful facilitators of healing and mental health. Coming to visual art, in the health humanities, the visual arts are used to move beyond a purely biological view of the body, instead, treating health and illness as biosocial experiences that are seen, felt, and recorded through culture. This field, often called visual medical humanities, uses art and visual culture to humanize medical practice and critique the social structure of healthcare. Visual arts are integrated into medical and health training to develop a specific professional habits of mind. And these includes one, diagnostic acumen and slow looking. Students study painting to practice close noticing, distinguishing between raw visual data, what is seen, and clinical inference, what is interpreted. Secondly, tolerance and ambiguity. Unlike clinical algorithms with right answers, art follows for multiple valid interpretation, helping students navigate the uncertain gray zones of patient care. Third, empathy and professionalism, viewing illness narrative in art, such as Frida Kahlo's depictions of chronic pain, helps students understand the subjective experience of suffering and vulnerability. Specific techniques are used to bridge the gap between art and clinical practices. These includes one, visual thinking strategy. In short, it is called VTS, a research-based method using three open-ended questions. What is going on here? What do you see that makes you say that? And what more can you find to build observational and communication skills? Second, crip aesthetics, a modern movement led by disabled artists such as Crillon Lazard that politicizes sickness using art to critique the social and political barriers of disability rather than just personal suffering. Third, body painting, used as a creative tool to teach anatomy, helping students visualize the special relationship between the skin surface underlying internal structures. Next, law, which is again very important in health humanities. So, in health humanities, law is viewed not just as a set of rules, but as a discipline that shapes the human experience of medicine by defining rights, duties, and the boundaries of acceptable conduct. It bridges the gap between scientific practice and social justice, ensuring that healthcare is both clinically sound and ethically grounded. Unlike the descriptive nature of medicine, law is prescriptive, laying down norms for how society ought to function. Within the humanities, it provides a lens for critical thinking, analyzing medical data not as fixed facts, but as information shaped by fallible human beings and evolving policies. Secondly, it also establishes human rights, shifting from consumer provider model to one focused on the dignity and citizenship of the patient. And thirdly, narrative power, using personal stories such as those of assisted dying to influence and shape future legislation. While ethics and law are complementary, they serve distinct roles in the medical field. Ethics are subjective and are guided by the individual morals and internal principles. For example, the four pillars of ethics, that is autonomy, beneficence, non-malfeasance, and justice. Law, on the other hand, is objective and refers to externally enforced rules and regulations designed to maintain order and protect citizens. Both these fields, ethics and law, converge on critical issues like formed consent, confidentiality, and organ donation, where legal requirements often codify ethical standards. So, the key areas of medico legal intersections. are Anthropologist and Humanities, a scholarly study some key areas of medico-legal intersection to understand their societal impact, and these includes medical malpractice and negligence, the legal mechanisms used to hold providers accountable and compensate patients for harm. Forensic medicine. This application of medical knowledge to legal proceedings, such as determining cause of death or providing expert testimony. Public health law, using legal tools like tobacco taxes, mandatory vaccinations, and environmental regulations to manage health at a population level. Emerging technologies addressing the legal and ethical gray zones of AI in diagnosis, genetic testing, and assisted reproductive technologies. Coming to history, in the field and health humanities, history is not just a timeline of discoveries. It is a critical tool for understanding how our current ideas about normal bodies and scientific truths were constructed over time. It moves away from great men of science narratives towards a broader look at social, political, and cultural shifts. Challenging medical progress, history in this field critiques the idea that medicine is a linear march towards perfection. It examines contingency, which refers to how medical practices like bloodletting or lobotomies were considered cutting edge in their time and why they eventually changed, and power dynamics, which includes how history has been used to justify the marginalization of certain groups, such as the history of eugenics and syphilis studies. The social history of medicine, which is very important part of the entire discussion. Rather than focusing only on doctor, historians look at firstly the patient's voice. This refers to using diaries, letters, and oral histories to understand what it was actually like to be sick in the 18th or 19th century. Secondly, the cultural context, which shows how religious beliefs, wartime needs, or economic changes, like the Industrial Revolution, forced medicine to adapt. Key historical concepts in medical humanities include the clinical gaze. This is a concept developed by Michel Foucault, describing how, in the late 18th century, doctors began to see patients as a collection of organs and symptoms rather than whole people. Medicalization. This refers to tracking how sins or social problems like alcoholism or hyperactivity were historically redefined as medical conditions. Epidemiology and colonialism. These involves studying how the spread of diseases and the development of tropical medicine were tied to imperial expansion of global trade. History matters for modern clinicians in threefold ways. Firstly, it brings humility, that is, recognizing that what we know today may be overturned tomorrow. Secondly, it brings empathy, which involves understanding the historical trauma some communities feel toward medical institutions, which helps explain modern issues like vaccine hesitancy. Thirdly, and finally, it provides a structural awareness which refers to seeing that many health inequalities, like those based on race or zip code, have deep historical roots that cannot be fixed by a pill alone. So, objectives of medical humanities include, and the primary goal of medical and health humanities is to humanize the practice of medicine by moving beyond to purely biological explanation of illness. So, the key objectives include validating lived experience. This involves prioritizing the personal narratives and life stories of those navigating health system. Secondly, challenging normative assumption. This involves questioning what society considers a normal or productive body. Third, interdisciplinary integration. This refers to drawing from history, literature, philosophy, law, and the creative arts to understand health and well being. Apart from these, other objectives of medical and health humanities are creating awareness on various illness conditions, enhancing knowledge on health related aspects, making an emotional appeal, promoting behavior change or call to action, giving insight into the diversity of human condition, developing critical thinking, and enhancing clinicians' ability to listen effectively and communicate empathetically. Why is there a need for medical humanities? Medical humanity brings reflective component to medical education that facilitate a deeper understanding of human experience. Medical and health humanities are essential because they act as a connective tissue between scientific facts and human values. While medicine provides the cure, the humanities provide the care. Well, here is why medical and health humanities are increasingly critical in modern healthcare. They help in combating clinical reductionism. Modern medicine often treats the body like a machine to be fixed. The biological view, the humanities remind that a patient is a person with a story, a family, a culture. It shifts the focus from treating a disease to caring for a human being. Secondly, they helped in developing narrative competence. A huge part of diagnosis is listening. Humanities training through literature and history teaches clinicians how to hear the unsaid. That is, pick up one nonverbal cues or subtext in a patient's story and bridge gaps. That is, understand how a patient's background changes how they describe pain or follow a treatment plan. They help in improving clinical observation. Using the visual art like slow looking at paintings has been proven to make doctors better at physical exam. It trains the eye to notice uh, tiny details, a slight skin discoloration or a subtle tremor that a distracted or rushed clinician might miss. They help in navigating moral gray zones. Science can tell us if we can do something like gene editing or life support, but philosophy and ethics tell us if we should. The humanities provide the framework for making agonizing decisions when there is no perfect medical answer. They help in preventing physician burnout. Healthcare is emotionally exhausting. Engaging with the humanities through reflecting writing, art, or history helps practitioners process trauma. By dealing with the grief and death they witness daily and find meaning through staying connected to the calling of medicine rather than feeling like a data entry clerk. They help in addressing structural inequality. By studying history and sociology, health professionals realize that a patient's health is not just about bad choices. It is often dictated by structural determinants like zip code, historical racism, or poverty, which requires a more compassionate, advocacy based approach to care. They encourage ethical and human rights inquiry. The medical and health humanities explores bioethics, autonomy, and social justice, interrogating how medical interventions and political impact the rights of people with disabilities. In short, the humanities ensure that as medicine becomes more high tech, it doesn't become low touch. The inclusion of medical humanities in medical school curricula helps to develop imagination and abilities for interpretation of data through analytical and synthetical reasoning, skills of close observation and careful interpretation of the patient language, empathy for the patients, and conceptualize and construct personal and professional values. They also add richness to medical education and practice and support the development of an exceptional medicine. They constantly progresses and satisfies the community's social, ethical, and scientific needs. The introduction of medical humanities in the undergraduate curriculum of Greek medical schools helped students in understanding the challenges within the field and its necessity. At the core of medical humanities is the belief in the importance of language as a means of individual expression and social change and appreciation of ideas from a variety of fields, and a commitment to affecting change through public discourse. Well, this is the time to wrap up the first discussion, which is the introduction, of course, dealing with health and disability along with medical humanities. Let us meet next lecture where we shall discuss in detail about the medical humanities and the various areas of medical humanities. Thank you very much.